Hi, everyone. Thank you for joining us tonight for Embrace, Encourage, and Engage Family and Caregiver Access to Resources on Anxiety and Depression in Children and Youth. This webinar has live Spanish interpretation, and we invite you to use that if that is something that you would like to use. To switch to the Spanish language channel, please click the interpretation button at the bottom of your screen and select Spanish. This webinar is also being live streamed on YouTube. My name is Lauren Bisutti. I use she, her pronouns. I'm a senior advisor at the Administration for Children and Families. It is my pleasure to welcome you to this training. This webinar training is co-hosted by the Administration for Children and Families, ACF, and the Substance Abuse and Mental Health Services Administration, SAMHSA, at the U.S. Department of Health and Human Services. We are in deep appreciation for the parent and youth leaders who have partnered with us in the development and delivery of this training. This training is an educational opportunity. If you or someone in your care is experiencing a crisis, we recommend you seek care immediately. You can call or text 988, or you can also contact findsupport.gov. All participants have been muted and cannot show video tonight. If you experience technical issues, please send the hosts a message in the chat. You can also contact us through the Q&A feature at the bottom of the screen or by emailing us at parentcaregivertraining@samhsa.hhs.gov. We're going to be compiling questions and responses in a frequently asked questions document that'll be posted with the slides and the recording of this training after this training is completed. We're recording and we'll make this available. We'll share how we're going to how you can access this recording and the resources via a follow-up email to everyone who registered. We will also be sending certificates of attendance via email to all participants who have registered. You can add your name to the certificate itself. We'll put instructions so that you're able to do that. On the YouTube channel tonight and would like a certificate of attendance, please still register for the training through the registration link so that you can receive these materials. And now it's my absolute pleasure to introduce ARC Move National, a youth-driven, chapter-based organization seeking to connect, support, and develop youth leadership in advocacy and to create positive change. As a queer and trans Mexican Indigenous person, Tay's life work is to ensure people are seen, validated, and celebrated for being who they are as they work in spaces to liberate individuals from and tackle systems that seek to prevent that. And Tay, I'll send it over to you now.
Awesome. Oh my gosh, thank you so much, Lauren. I so appreciate you. Lauren was like, hey, do we know anyone that has like a red emo haircut and like a sleeveless jean jacket that we can get to host this thing? And I was like, I got you. So hello, everyone. Welcome. Like Lauren said, my name is Arc Tello Saint Amor, but most folks call me Tay. My mandatory pronouns are they, them, their. And not only am I the executive director of the awesome organization, check us out, Youth Move National, I will also be your host for today's event. This event, let me just share with you, is deeply, deeply important to me as someone who has that lived experience, who has co-occurring serious mental illness, including depression and anxiety, and a few other fun things. It's deeply, deeply important to me, this subject matter. And let me tell you, we have some amazing, fantastic folks here with us who it's just an honor to share space with. So let me walk you through it. This is what we're going to be doing tonight. We've got the amazing Dr. Sunny Patel here. He is going to walk us through a short presentation. Then we have Decoria Jones, who'll be taking us through a breathing and centering exercise. And then both Sunny and Decoria will be joining Chris Locus, someone who I'm genuinely proud to call a close friend, in which I would hope so, because gosh, we've done so much together. We've been on a youth panel, 2 DEI presentations. We're writing a paper together, and that's literally just this past week. So it's an honor to be in space with Chris again this evening. So Decoria, Sunny, and Chris will be talking to us about how we can recognize and navigate and be sort of what I would say in right relations with depression and anxiety. And they'll be representing their different roles and perspectives. It's going to be awesome. Then we're going to invite Candace Lindsay into the space to talk about some resources related to these topics. So we've got some great stuff in store for y'all this evening. And I would be remiss if I did not mention two in particular special guests who we have with us this evening. One, Dr. Miriam Delphin-Rittman, the Assistant Secretary for Mental Health and Substance Use in the United States Department of Health and Human Services, and the Administrator of Substance Abuse and Mental Health Services Administration, and the longest title ever is here. Is there anything that she doesn't do? She's amazing. I'm so glad that she is with us this evening. And then lastly, but not of course least, as someone who I will stop rambling and introduce y'all to right now, is January Contreras, who serves as the Assistant Secretary for the Administration of Children and Families at the United States Department of Health and Human Services. In her role, the Assistant Secretary works to strengthen the well-being of the nation's children and families with a focus on prevention, safety, economic stability, and equity. Throughout her career, she has been motivated by a sense of duty to children, families, and individuals, especially when they are facing their most difficult moments. For more than 20 years, the Assistant Secretary has championed safety, stability, and opportunity for children, youth, and families. Oh my gosh, it is an absolute honor to see you again, Assistant Secretary. I welcome you into the space.
Thank you, Tay. I appreciate that. And thank you for your leadership. And thanks to everyone for joining us today. I'm January Contreras, as Tay said. I have the incredible privilege of serving as the Administration for Children and Families Assistant Secretary. And on behalf of Secretary Javier Becerra, who is our secretary, I just welcome you. I thank you for making the time to be here. If you came to previous trainings that we held one in March, welcome back. And if this is the first time you're joining us, we're just so glad to have you. And we hope that this information is as valuable to you as we intend for it to be. My pronouns are she, her, and hers. And as the leader of the Administration for Children and Families, or ACF, I get the privilege of working with partners across the U.S. Department of Health and Human Services and the federal government as we really follow through on our commitment to integrate mental health supports and services into our existing systems. We know that there are systems that people rely on, including social services and early childhood programs, which we run right here at ACF. So I'm excited that ACF is continuing to collaborate, particularly with SAMHSA, the Substance Abuse and Mental Health Services Administration, and to continue to partner with parents and youth who tell us, this is what we're experiencing, this is the kind of ways that we can be helpful. And here we are bringing another piece of the series of Embrace, Encourage, Engage, our training for parents and caregivers about children's mental health. And so glad to be here with you today. Earlier in the spring, we asked parents and caregivers who attended our previous training how we could be most helpful to them when they're navigating behavioral health challenges. What kind of information and tools are going to be helpful? So we're grateful from the input of over 600 people who shared ideas with us about how to incorporate their advice and their experiences into this training series. And that's only one way, that survey is only one way that we're listening to parents and to youth and to families and caregivers all across the country. I have this opportunity to travel, to meet community where they live in their own backyards. And really every day we're hearing about what parents and families are experiencing. And we hear about success stories of accessing resources and support and the difference that can make for a child and their family. And we hear about challenges that are persistent and that we must continue to work on together. So one of the ways that we're implementing the findings of the survey is through this training. Training about specifically helping and supporting children with anxiety and or depression was one of the issues that people most often suggested that they needed, that would be valuable to them. So we know in many homes across the country that parents and caregivers and youth themselves are increasingly thinking about or giving voice to mental health and worrying about people that they care about. Younger generations are growing up with increased stress and anxiety. In fact, according to the CDC, depression and anxiety in children aged 6 to 17 has increased over time. And it's also likely to occur with other mental health conditions. So this is data that makes us all pause to understand, how can we help? What is our role? And by being here, you are taking on a role. So thank you. While there are many reasons for the data, including the impact of social media, as well as the pandemic, as a fellow parent, keeping up with the increasing complexity of the world and how it is affecting our youth can be so challenging. Our young people have a lot to deal with out there. And so these tools are what we hope will make a difference, because there is hope. Younger generations are more likely to seek mental health counseling or therapy. I hope this signals that there's less stigma. Young people are really taking that what their needs are and voicing that. However, we still have a lot to do to increase access to mental health services, and that's true especially in communities of color and LGBTQ+ youth and families. We also have challenges to meet in rural areas, in our tribal lands, and we work on that every day here across HHS. We know that parents, caregivers, and families want and need resources that are relevant to their culture, to their backgrounds, to their language, and to their community. ACF is honored to be a partner in advancing behavioral health supports and integration for youth and families. And this training is one part, but we also have developed a web page that we want to share with you in case there are others that you can share that with, as well as making sure that you have it yourself. And our partner here, SAMHSA, has a wealth of resources available. One thing I want to mention while I have everyone here is we're in a all hands on deck moment at HHS and across the government when it comes to Medicaid renewals. Some of you may remember that at the beginning of COVID-19, the pandemic, there were significant changes made to Medicaid enrollment and eligibility to make sure that people would not lose their Medicaid coverage during the pandemic. Now that the public health emergency has ended, those flexibilities have ended, and all states are resuming their regular processes for renewing individual Medicaid coverage. There are millions of people who are have the potential to lose their coverage, even if they're eligible today. So this talk is about mental health, but for all of you out there, I want to encourage you to look at these resources. CMS, the Centers for Medicare and Medicaid Services, has put a lot of resources out there, tools and tips that we can share with our neighbors, with people we work with clients, in order to help them understand that they don't have to lose their coverage if they take a few actions. And we know that access to healthcare is one of the key challenges in addressing mental health. So we want to see as many people keep their coverage as is possible. So with that, I want to get back to the webinar. I want to recognize the incredible leaders that have joined us on this call, who are going to share their own experiences and expertise. Chris Locust, a youth advocate, gave their time and expertise to developing the contents of this webinar and even produced the artwork for the event, which I love. You'll hear from them about the challenges of accessing care in youth settings and the suggestions they have for parents about talking to children and teens about anxiety and depression. We'll hear from Takoria Jones, a parent who also gave her time and expertise as a parent who has advocated for her children and the mental health care that they need. And during our last webinar, I urged parents and caregivers to take care of themselves. I want to leave that message again. We have to take care of ourselves in order to take care of others. And we'll get to hear from Takoria about her experiences as a parent. And I'm excited that she's going to lead us through a brief self-care exercise that we can use in our everyday lives. Again, I want to thank you for taking the time out of your day to be here with us. to learn together about anxiety and depression in children and youth, to reduce that stigma, to not be afraid to learn so that we know how we can help as parents, as caregivers, as family members, as friends. We want to support the children we care for and love, and you investing this time is one way that we hope to empower you to do that. So we hope this makes you feel empowered and it helps you strengthen the wellness of the youth that you interact with and care about. I'd also like to mention the training was developed with the unique insights of Tay, our fellow Saint Amour, who will also be our MC. As he kicked off our program, you might have noticed, we're grateful for their deepened partnership with us, and I'm going to turn it back over to Tay. Thank you.
Oh my gosh. Thank you so much, January. I so appreciate you. The Assistant Secretary, everyone. Oh my gosh. Always an honor to be in your presence. Okay, so we are going to keep it moving. I also want to introduce y'all to another amazing individual, Dr. Sunny Patel. Sunny is a child, adolescent, and adult psychiatrist serving as the senior medical advisor at SAMHSA Center for Mental Health Services. Before SAMHSA, Dr. Patel was appointed a White House Fellow. What? That's awesome. And served at the Department of Homeland Security, where he focused on issues at the nexus of immigration and public health. Dr. Patel, I welcome you into the space.
Thanks so much, Tay. I'm going to spend the next 10 minutes or so talking about parenting and youth anxiety and depression. So, if we break it up into 3 parts, we're going to spend a little bit of time thinking of defining anxiety and depression in children and youth. The third, thinking about the signs and symptoms across the developmental stages. So what does it look like in young children, in school-age youth, and then in teenagers and adolescents, and then very practical tips on how you can support your child if they are struggling with anxiety or depression. So disclaimer, as I made last time, for this presentation, we use parenting as a very broad term, and families is also meant to be inclusive for all individuals who are responsible for a young person and all the shapes and forms families take. And the purpose of this talk is really to provide a very practical primer, an introduction on anxiety and depression, and hopefully will leave you all with a few facts, and you'll have learned something in the time we spent together. So defining anxiety and depression, this is from surveys that SAMHSA does, as well as our colleagues at the CDC. And we know 4 in 10 children in America during the pandemic had endorsed feeling persistently sad or hopeless. We know 2 in 10 children meet criteria for depression, and 3 in 10 children have any anxiety disorder. And 2 in 10 children also reports serious suicidal thoughts. This is all to highlight that the kids are not all right. That, from this data and from your experience, well the challenges children and youth are facing in our country. So just by way of definition, we're going to go into this in much more detail, but we define depression here, not the occasional sadness, which is a normal part of growing up, but if children are feeling sad or irritable and no longer enjoying things, and it occurs day after day, it might be indicative of depression. And so something for us to look out for. And anxiety, we know that fears and worries in children can be common and are developmentally appropriate. However, fearful anticipation, this worry that something bad is going to happen or danger is going to come, accompanied with physical symptoms or unpleasant feelings, that's also persistent. That's something for us to worry about. So these are sort of practical definitions that we're going to use for depression and anxiety. So what causes it? Well, really, we don't always know what the cause of these big feelings are. And sometimes they can feel like they come out of nowhere. There's no single test to diagnose anxiety or depression, but we do know there are risk factors: genetics or family history, stressful life experiences, traumatic experiences. We also know that each child has a different temperament that they are born with, and temperament affects this, and certain medical conditions that might might lead to depression or anxiety or make pre-existing anxiety or depression worse, and then substance use and misuse. And really to highlight that there may be biological or genetic factors that lead to this, as well as environmental factors. And it's this gene-environment interaction that really can really present anxiety and depression in its sort of full form. So signs and symptoms across developmental stages, really the three big questions for us to be thinking about are, is this age appropriate? How intense and persistent are the behaviors? And do these behaviors or feelings interfere with my child's life or our family's life? And it's really these guiding questions should help us as we're sort of thinking about concerning sort of signs or symptoms we're worried about. So for signs and symptoms of anxiety, there are physical symptoms like headaches, stomach aches, fatigue, changes in appetite or sleep, emotional symptoms, including persistent worry, low self-esteem, mood swings, and then behavioral symptoms such as withdrawing from friends or avoiding school. Those are things that we worry about. Now, if we think about this over a developmental continuum, that is, if we think about in early childhood, in school-age youth, and then in adolescence, in early childhood, it can present as frequent crying or excessive clinginess or stomach aches, headaches, school avoidance, excessive worry. And really the thing to highlight is in early childhood, the physical symptoms might be more pronounced. In school-age youth, often it can be perfectionism, self-doubt, difficulty separating from parents or primary caregivers, withdrawing from social engagement, and often this preoccupation with the what if something happened, or what if something bad happened. And then in adolescence, it's irritability, difficulty with concentration, increased sensitivity to criticism, school performance, sleep issues, and then substance misuse. Those are things that we really worry about. And so if we sort of think about this in three different sort of phases of childhood and adolescence, these would be the big symptoms. For depression, it can be difficult to recognize because it can manifest in lots of different ways. It can show up in different ways depending on a kid's age. But really the take-home point here is, in adults, low mood can be the sign of depression. In children, it is often irritability. That's the hallmark symptom of depression. So that for us to look out for that. And then really the big thing for us to think about is change in in their behavior, their typical behavior. And so to look out for, are they behaving differently? Are they feeling differently than they normally would? Common signs here in early childhood, really it's like this absence of joyfulness, physical complaints, difficulty concentrating, lower energy, irritability, and change in appetite and sleep patterns. Whereas in school-age youth, often it's more moodiness and acting out and oppositionality. There can be feelings of hopelessness or excessive guilt, heightened sensitivity to criticism, feelings of worthlessness. And the thing to really think about here in school-age youth and in adolescence are thoughts of self-harm and suicide. And although they're more common in older children, we are seeing concerning trends with school-age youth also endorsing these feelings, and we want to be attuned to that and make sure we respond. And in adolescence, really the big hallmark things are thinking about irritability, substance use, and then lack, of outward physical sign is often a lack of interest in personal grooming or appearance, which is different than perhaps what their baseline is, what they might normally be like. And then feelings of self-loathing or social withdrawal or isolation. These are all big things for us to be thinking about. And then the same concerns around suicide are present here. Now, you might think, wow, as you were talking about anxiety and depression, there's a lot of overlap. Well, you would be right, because there are a lot of overlapping symptoms here between depression and anxiety. And so, some of the big overlapping symptoms are irritability, and in younger children, tantrums, and older children, defiance, concentration and memory difficulties, sleep problems, excessive guilt and preoccupation with errors, tired, low energy, and then changes, negative thinking, and thoughts of self-harm or suicide can present in both. And so, the take-home point here is often depression and anxiety go together. And so if you're to look out for both issues and ask about them if you are concerned. And so how do you support your child? How can one support their child? One real thing for us to highlight is the United States Preventive Services Task Force. So this body of experts that the government brings together to think about what should we be doing for everyone in America in terms of for preventing illness. Recent recommendations from this past year have highlighted universal screening for anxiety and universal screening for depression in youth. And so this is a big deal because if your pediatrician's office wasn't already screening, this is a recommendation that should be implemented. And part of the thinking here that I want to sort of impart is if we're not looking for it, we're less likely to find it. And so screening, which means asking standard questions, is really important so that we don't miss anybody and no kids are falling through the cracks. And we know, a big touch point children have is with their primary care doctor. So how can you support your kid, your child or children in your life? Well, we know that for anxiety, it's really important for us to validate children's feelings, helping manage their symptoms, setting realistic expectations, and then talking through their worries and modeling healthy ways of handling anxiety. So really letting kids know that you're in it with them. For depression, it's really important for us to listen carefully and provide emotional support, encourage a healthy lifestyle. So this idea of behavioral activation, that if you're feeling crummy, the default is to sort of withdraw and remove oneself from all the normal things one would do. And so to do the opposite, right? To get exercise and eat healthy and engage with other people, even if a child's not feeling well, to encourage that. And then helping a child feel connected and knowing and helping children know that change is possible. And that there is hope. And I think that's a really important thing to leave our kids with that feeling. So really briefly, treatment options. It's really important to be able to meet with your behavioral health provider or more likely a pediatrician who might be able to help guide in what treatment options there are. Getting the education on symptoms and treatment of depression and anxiety in children and youth, that's really important because often it's not intuitive. What these symptoms are, and then what should one be doing. And then, the two big modalities are talk therapy and medications, and the first line treatment is talk therapy. And so really to highlight that. And there's lots of medication guides if your child does need medication, and the American Academy of Child and Adolescent Psychiatry and the American Psychiatric Association have put out these guides for anxiety disorders and depression. And so would definitely encourage you to check that out. So in some, we know that anxiety and depression is quite common. We know that the symptoms are more physical in younger children and more emotional in older children, and that really providing a safe, validating space that lets children know that you're in it with them and you're there to provide support is the message that I would leave you with. And if you need and for resources for help, my colleague Candace Lindsay will be sharing some resources. So thank you so much.
Awesome. Oh my gosh. Thank you so much, Dr. Patel. Really, really appreciate you. I feel like I learned something new every time you talk. So it's just an honor and a privilege. Thank you so much. Okay, so we're a little bit behind. We're going to keep it going. Next up, I wanted to introduce y'all to Takoria Jones. Takoria is a mother to 6 and an active change agent. Her restorative work focuses on health and well-being, food policy, and therapeutic massage, with a mission to create a community-centered massage clinic promoting mental health and good body mechanics, which sounds amazing and awesome. Oh my gosh, as soon as you open it, please tell me. Takoria is going to lead us through a brief mindfulness exercise. We're going to do some breathing together, and then we're going to move into the main event, our panel. Takoria, I welcome you into the space.
Thank you so much, Tay. Alrighty, so this is a connection activity. It's called life support, recognizing that as humans, there are things we all need. And acknowledging them, it is my hope that it connects us in this space. So let's breathe. Let's breathe in happiness. Choose it. Let's breathe out hope. Spread it out. Let's breathe. Let's breathe and thank the trees and all things green. Let's breathe happiness, hope. Let's breathe and thank the ground to stand on and for the roots to go down. Let's breathe happiness, hope. Let's breathe and thank the air. It helps us remember that we share. Let's breathe happiness, hope. Let's breathe and thank the sun, a fiery star that shows us one. Let's breathe happiness, hope. Let's breathe and thank the water for being mostly what we are. Let's breathe happiness, hope. Let's breathe and thank each other. I am because we are. Let's breathe happiness, hope. Let's breathe. And I hope we're all nicely connected now.
Oof, oh my gosh, Decoria, I love that. I didn't even realize how much I needed that, and I'm feeling that. Oh, thank you. Yeah, I talk about often how it's so important to slow down, be mindful and aware of your whereabouts, and maybe prime your thoughts with good intention. I just feel like, oh gosh, you just created a really perfect space for us to move into our panel this evening. So gosh, thank you so much. So don't go anywhere. You stay right there. We've met Sunny, so we're going to bring Sunny back into the space. And without further ado, it is my pleasure and honor to introduce you to my friend, Chris. Chris is a certified peer recovery specialist and a certified trauma recovery coach. They are passionate about using their lived experience as a non-binary queer BIPOC, yes, high five to that, individual to bring about change through numerous speaking engagements that I've had the pleasure to see many of them, hoping to highlight the necessity and value in peers of all spaces. Chris is now working as a transitional age youth coordinator for On Our Own of Maryland, working to advocate for the inclusion of young adults as equal partners in the process of systems change on a local, state, and national level. They are brilliant. They are amazing. They are my friend, Chris. Please, please welcome. Okay, so I see I have all of us here in the space. We've got probably about 16, 17 minutes. So I'm going to try to kind of get to these questions as fast as I can, because I feel like it's really, really important for folks to hear from y'all and all of your diverse perspectives and the roles that you serve in this. So my first question really is to you, Decoria. Can you describe sort of like what you noticed within your own child when they were feeling sort of anxious, depressed, and how did you respond to that? And how did you sort of navigate that process of getting them care?
Absolutely. So of the six, I'm gonna pick the most recent. So as Dr. Patel, kind of reminded us, typical child development is full of kind of ups and downs and things. So you kind of, you learn your child, and this child of mine was particularly happy. Every day off the bus, oh, today was the best day. Every day was the best day. Then all of a sudden it became visits to the nurse for stomach aches and headaches. It became, leaving the classroom at school and calls home. It became, he'd get off the bus and, hey, mom, and that's it. And so I knew there was something going on with that particular child. And so I did my typical check-in. Hey, are you okay? What's going on in school? Tell me about it. Let's sit on the porch. Let's have a snack. I love you. I'm here for you. You can tell me anything, right? And that got us absolutely nowhere. He continued to come off the bus and not talk. I continued to get calls from the nurses. Your son is having a stomach ache. I got frustrated as a parent, in all honesty, because I figured I could fix it, right? It was my kid. I hadn't been aware of anything majorly happen in our lives, at least not to me, right? As the parent. So I got frustrated, like I should be able to fix this, but I couldn't. And so I had to take a moment to say, okay, this isn't about me. And it turns out that my kid needed somebody at school. And I got to be able to see him grow and see them grow in that, because they needed their community. So I did enough of what I should do as a parent, right? To show him his social connections and how strong it is to find the person that you trust, and celebrated that he could do that. Now, I'm just the mom in this place, so I really would like to ask Chris kind of this question. As the young person here, what kind of advice would you give caregivers concerning moods and anxiety in young people?
Yes, absolutely. And I appreciate you sharing and being here. I think what is very important, like Sunny and what you have said, is to take notice of the behaviors when things are starting to change and use that as an opportunity to be vocal and honest, and using a lot of I statements when talking to your child so they don't feel attacked. But also leaving space for them to come to you when they're ready. And I think that's sometimes a part that can be left out, is that we expect them, like, oh, we're coming to the table with honesty and now it's their turn, but they may not be ready for that. And so leaving that space, but also allowing them to show up in a way that feels comfortable for them. So that could mean them writing you a letter or sending a text message or showing you a TikTok that they think, oh, this is how I feel, and being open and malleable to those things. I would also recommend checking on your strong kids and your happy kids, like Takoria was saying. I was one of those kids who showed up well in school. I had good grades. I had a lot of friends, and I was still going through struggles. And I think if a parent at that time would have paused and been like, hey, how are you actually doing underneath all of these things that you are doing well? It would have completely changed the trajectory of what I was going through, but no one asked me because on the surface, I seemed like a good kid. And what I know to be true is that our good kids, our strong kids, the ones who seemingly support and continue to show up, also need that help too.
Oh gosh, that's brilliant, Chris. Yeah, 1000%. Thank you for sharing that. So to Corey, I'd actually just bounce it right back over to you. What do you wish you knew, or is there something, of course, hindsight being 2020, is there something that you wish you had known earlier about depression and anxiety, how it comes up in children, and what would you want other parents, caregivers, families, etc., to know about that, and how to access that care for their loved ones?
So I'm going to continue that thread Chris started about the acknowledging the surface, right? It looks good on the outside, and as parents, we're often genius at masking the outside, right? It's fine. We've got all the weight of the problems and things, and kids just get dressed and go to school, right? What's going on here? But I think for me, acknowledging that children see and know way more than I ever kind of put together. Like, they just suck it all in. They know what's happening, regardless if you shared those actual words and experiences with them. So I wish for myself that I had been a much better model of self-care and emotional intelligence, and been very transparent about how I feel and what I'm going through, in an effort to to make that okay. Like, yeah, mom can get up and go to work, but maybe she doesn't like her boss so much, so that, how do you deal with that? And it teaches them skills as well. And also that systems can be challenging in seeking mental health assistance. It's just what it is, especially as people of color looking to find therapists that match and that kind of thing. It can be very difficult. Had I thought a little bit sooner, he's in school every day. Who's at school? these are places like he goes to the barber. I wonder if I could ask his barber just to kind of check in with him. So remembering that social connections are always present, and maybe that child needs to hear it from the barber or from the storekeeper. So do not hesitate to recruit your village. I wish that had been more forward in doing that, because positive connections do matter. And typical development, it's complicated. It's complicated enough, and I'm really glad Dr. Patel is here. And so I'm gonna just pass him the next question, if you don't mind, Tay, and ask him, Dr. Patel, what can you help us and share with us around engaging with mental health professionals? It can be kind of hard sometimes.
Yeah, totally. And I really appreciate this conversation and sort of being in the space with you all. I think one of the things for us to think about, which I touched upon briefly in the talk, was, when should we think about engaging with a mental health or behavioral health professional? And really, it's when we notice that the symptoms, the signs that you notice in your child, start interfering in their daily life. That's a really good place, and especially things related to school performance. If you're noticing a slide, or decline, like that's something to sort of cue into. Friendships, especially in teenagers, friendships are a really big part of teenagers' lives. I mean, they're part of all of our lives, but really important for teenagers. And when things are going awry there, it's something for us to cue into of like, what's going on? Like, another is withdrawal from regular activities. They used to love painting and now they're not painting anymore. What's going on? So these are the kinds of things. And then if there are other symptoms, like physical symptoms, and they physically check them out and there's no underlying like cause, and they still continue to persist, that's something to cue into of, you're getting a stomachache every time you have to go to school. And a phase would be, maybe it lasts for a little bit of time. Maybe it lasts the beginning of the school year. But, where it becomes concerning is if it's weeks into the school year and it's still going on, that would be something to cue into. And so how persistent and how severe a feeling or a symptom is, that would be a place to figure out, maybe we should talk to a behavioral health or mental health professional to try to understand what's going on. Because we know early intervention is important, that the earlier we intervene, and I think Chris was touching on this, of, often kids don't let on what they're actually feeling inside. And then it's not until they're in college or later in life that they actually get the help that they need. And so if we're able to cue in earlier, it can really change a child's ability to sort of manage in the world. And so I think that's really important for us to keep.
Yeah, thank you, Sunny. Really appreciate that perspective. Well, speaking of you, Chris, everyone keeps talking about your brilliance, so let's welcome you back to the space. When you were experiencing challenges and feeling down, and which I'm sure still comes up, when did you first get the sort of like help that you needed, if you feel comfortable sharing? And in doing so, what did you find maybe most helpful, but also maybe what did you find to be the most challenging? And how did you kind of like navigate that, if you will?
Yes, absolutely. I do feel comfortable. And before I get into that question, I do want to add on to what Sunny was saying. For me, the symptom, if you will, that showed up was disordered eating, which is something that is not talked about often, which led to me having an eating disorder. So I just want to highlight that can also be something to take note of if you're seeing that your child is changing their eating habits. That can be something as well. So when I was in high school, I did have a great guidance counselor that I talked to, but that is where my support stopped. It wasn't something that went outside of school. I was not recommended a therapist or peer support specialist or any type of familial support. And so I did not go towards the option of therapy until college, mainly because I knew of the services, but also because they were paid for, which was very helpful. I didn't have to worry about cost. And for me, unfortunately, my first therapist was not a good fit for many harmful reasons. And that led me to being re-traumatized. And at the time, that did stop me from pursuing therapy for many, many years. Now, when I look back on that, I understand that it's okay. And also, it's normal that you may not click with every professional that you seek out, and that's okay. And what is always true is that we still deserve to feel safe in community with those that we're seeking help from. And so even if you don't click with your first, second, or even third therapist, it's okay to keep trying and using those as learning experiences about what you like and what you don't like, and continue to take that with you with every individual that you meet. And also continuing to push forward, knowing that you deserve to take up space and that you deserve to have the support that is beneficial for you.
Gosh, thank you so much, Chris. Okay, so we've got just a few more minutes left. We've got about 3 more minutes left before we have to transition on. But we have 2 questions left that are so important. So, Tokoria, I want to pass it back over to you. Taking care of children and youth who are struggling can be challenging, as I know you know, as I know as a parent as well. Can you speak to what you've done as far as self-care, right? Self-care is a big buzzword, but what does that like really look like? And what does it look like for you? How do those challenges sort of present themselves, and how do you take care of yourself?
It was definitely a commitment. So, you find what it is that works for you. And if it doesn't work so well, then you find something else. Like you keep pursuing, happiness and that kind of thing. And you do it so everybody can find your self-care mechanism. That there's so many things to list. But what I want to stress here is the value of it. It can be very difficult for people who never had this idea of, I need to take care of myself. I need to apply my oxygen mask because I need to be centered and well enough to spread this care. The added benefit of doing that extra bit of work to make sure you do your self-care, to make sure you model it, multiplies and passes on. Your children see you, then they take that to their social groups, to their interactions. They bring those skills and emotional intelligence to the relationships they have. And then we just kind of pass it on, every little interaction. So just self-care can be a challenge, but if we lean into the value of it and understand how good it is for all of us that are connected in our family and our community, then it becomes a priority. Yep.
That's perfect. Yeah, thank you so much. Sunny, I'm going to give you the last word on the panel. We've got about 1 minute. So what does help look like for kids and youth with a mental health disorder from your perspective as a doctor, as an expert in this field? What have you seen?
Yeah. So, I touched upon it in the talk, but to add, obviously, the things we probably come top of mind are professional counseling and therapy, medications, if appropriate, family support, if that's something, or chosen family support, as in the forms that comes, and parent education around what depression and anxiety might look like and how to best respond. And then additional things to really highlight are school support and accommodations. That is a right under the American for Disabilities Act. And so if your child needs additional support, there are things called like a 504 plan or an individualized educational plan, IEP. Those are 2 sort of buzzwords to take back and look up some more, given that I can't go into great detail. But those are things that the school has to implement if your child needs extra support, making sure that they're, and then peer support and sort of promoting social connection, also really important, where available, and really seeking that out. And then really making sure that there's follow through, because I think the big thing is trust and to be able to show up and to consistently deliver. And so what does that look like? Making sure that you're able to help the child get to the appointments that they need to get to, and checking in and making sure they have all the support. And so those would be sort of big buckets of what help would look like. And if I have the last word, I think I just want to leave folks with this idea that there's hope, and that recovery is possible, that kids can get better and do get better. And that's something for us to sort of really emphasize as children and youth engage in treatment.
Oh gosh, I love that, Sonny. Yeah, there is hope and folks can get better, especially when we are honoring youth and kids for their whole authentic and holistic selves. So I love that, appreciate that. Okay, let's keep it moving. We are running short on time, but I want to talk about resources. So what I'm going to do, I'm going to invite Candace into the space. Candace is a licensed clinical social worker and a certified case manager specializing in youth mental health, care coordination, and behavioral health advocacy, serving as a public health advisor at SAMHSA's Center for Mental Health and Services. She focuses on initiatives serving children, youth, and families to improve behavioral health outcomes. It is a pleasure to see you. You look wonderful. Please, what resources do you have for us?
Thanks, Tay. And thank you everyone for joining us tonight. We understand that navigating behavioral health services for youth can be a challenging task, especially during times of crisis. You may also be thinking about your own mental health and well-being. Tonight, I'll share with you specific tools that you can use to help address depression and anxiety in your child. And I will provide you with resources for how you and your family can receive support and assistance. After the webinar, you will receive an email with links to ACF and SAMHSA's webpage for parent and caregiver resources, which includes federal and national resources to use when in crisis or seeking treatment for mental health and substance use disorders. FindTreatment.gov is an online treatment locator for individuals seeking services based on geographic location. In addition, FindSupport.gov has an array of resources, including how to find treatment providers, how to schedule an appointment, how to practice self-care, among other practical ways to navigate the behavioral health system for yourself and your child. I would also like to highlight that reaching out directly to your community providers is a great way to connect to care. You can contact your pediatrician or pediatric primary care provider. Your community may also have school-based mental health services and local or county behavioral health clinics. If you have insurance, contact your insurance company directly to obtain information about your benefits and obtaining a referral for treatment. They may have a behavioral health case manager to assist you in getting the help your child needs. Also, as a reminder, the 988 Suicide and Crisis Lifeline is a free resource. Again, free resource that is available 24/7, 365 days a year through text, chat, and voice calls, and is accessible in Spanish. ACF has a behavioral health webpage with a section specifically for parents and caregivers, including a section with resources about behavioral health in young children. We encourage you to explore the resources that are available. Tonight's webinar can also be a resource. ACF and SAMHSA will post a recording of tonight's training along with the presentation slide at www.samhsa.gov. And if you're interested, you can receive a certificate of attendance for tonight's presentation. You can also contact us at parent-caregiver-training@samhsa.hhs.gov, where you can send questions or comments directly to SAMHSA and ACF. We plan to host another webinar in September and hope that you will join us again as we continue to provide information, education, and support for you and your family. Thank you. Back to you, Tay.
Awesome. Thank you so much. Okay, speaking of wonderful people, I do not get the last word tonight. The awesome, the brilliant Dr. Miriam Delphin-Rittman does. So it is a pleasure to introduce you to her. She's a clinical psychiatrist currently serving as the Assistant Secretary for Mental Health and Substance Use in the U.S. Department of Health and Human Services and the Administration of Substance Abuse and Mental Health Service Administration. And I know we're running short on time. I just had to do the whole thing all over again because it is brilliant and awesome. So she previously served for over 6 years as the Commissioner for the Connecticut Department of Mental Health and Addiction Services. Dr. Delphin-Rittman is committed to promoting recovery-oriented, integrated, and culturally responsive services and systems that foster dignity, respect, and meaningful community inclusion. It is an honor to welcome you into the space. Assistant Secretary, please close us out.
Oh, thank you so much, Tay, for that wonderful introduction. And, I just want to thank everyone for joining us this evening, for being with us. We hope that you found this webinar informative. I also want to thank Assistant Secretary Contreras and the ACF team as we continue to collaborate really on efforts to improve the behavioral health for children, youth, and families. As Assistant Secretary Contreras shared, this is our second parent training that ACF and SAMHSA has held. The part 1 training is available on the SAMHSA website, and you can look that up under parent and caregiver resources. You'll see a video of the training as well as a range of resources that we shared during that training. And then today, as you know, we went deeper into a really more in-depth look at youth who may be facing anxiety and depression and ways to address resources and supports and to recognize youth that may be struggling. You may wonder, of course, why we focused here. And, as it was mentioned during the training, anxiety is so common. It is a common and serious mental health condition that really can affect millions of children and does affect millions of children and youth every year. However, we do know that many young people with anxiety do not receive the help that they need. And untreated anxiety disorders can lead to more severe problems, including depression, school failure, and use of substances, as we heard during the training. Depression, we know, is also common. And as you heard during the training, our NSDA, or National Survey on Drug Use and Health, shows that about 1 in 5 youth aged 12 to 17 have experienced a major depressive episode. And of these, nearly 75% had symptoms that were consistent with severe impairment, and more than half of those youth also did not receive treatment. So we know that this is something that is so important to pay attention to take a look at, and to really work to connect young people that may be struggling to services and supports. You did hear about a number of the resources that are available, so I just want to reiterate a few of those in my brief time remaining. Remember, there is a 988 Suicide Crisis Lifeline. You heard about that. That is available 24 hours a day, 7 days a week. You can access that by calling or texting 988 or chatting to 988lifeline.org. And again, that's available 24 hours a day, 7 days a week, all year round. What we do find is that adolescents and young people tend to prefer the text and chat function. And so that has been highly utilized by young people. And then remember, there's also the findtreatment.gov and findsupport.gov, which you heard about as well. But again, just want to thank everyone for joining us. I want to thank our panelists and speakers that we had. Many thanks to Tay for emceeing tonight, and then also to Cora and Chris and Candace and Lindsay. So appreciate the team that puts this together. Again, our goal was to provide you with timely and relevant information to improve the behavioral health of children, youth, and families across the nation. We hope we accomplished this goal. Feel free to provide feedback. And if you have any other questions that you'd like to ask, you can send us your questions through the Parent Caregiver Training at samhsa.hhs.gov, and we will respond to those questions. Finally, again, we just want to thank everyone for joining us. Thank you for your engagement. Thank you for your questions and your commitment to improving and enhancing the overall mental health and wellness of children, youth, and families. And so we hope that you enjoy the rest of your evening. Again, thanks for joining us. Good night.